Moving on to our second presenter, we have Mr. Yaseen Ayobi, who is presenting a paper entitled Grounded Theory Examination of Humanitarian Leadership Practices in Mosques, Jirga Hall and Cluster Meetings in the Context of Internally Displaced People in Afghanistan. Yaseen is a research consultant and a PhD candidate at the Center for Humanitarian Leadership at Deakin University. His recent research includes humanitarian networks in Somalia, India, Bangladesh, Pakistan, and Yemen, and he recently completed a major research project focused on the dignity of displaced people in Bangladesh and Afghanistan. Yaseen holds a Master in Evaluation from the University of Melbourne and has worked on a wide range of evaluation and research projects across the Asia Pacific. Yaseen, thank you for being on the panel today, and I will give you the floor.
Thank you very much, Kai. It's my pleasure to be with you on this panel, and I'm very pleased to be presenting my research on humanitarian leadership. Hi, everyone. As Kai mentioned, I'm Yaseen Ayobi. I'm presenting a research on humanitarian leadership. I have used a grounded theory approach, which is quite rare in humanitarian settings. Research just on humanitarian leadership has been conducted from post-positivist quantitative researches quite a lot. But grounded theory is rare in research context. So I have visited Afghanistan over 1 year long period and conducted my research from qualitative point of view. I have conducted observation, I have conducted also key informant interviews, and that was conducted has a quite expansive approach at 3 different layers. I have observed the humanitarian cluster meetings in Kabul. I have visited provinces in different areas, geographical areas, to observe the humanitarian operation meetings. I've also visited the affected community. So the focus of this research was quite expansive from a data collection point of view to understand what humanitarian leadership is, what it means to be humanitarian leaders, or to engage in humanitarian leadership. So I've called these 3 different layers of management or engaging in humanitarian intervention: micro level with affected community or those displaced by crisis, and then at meso level is really working with the provincial government and those who are designing the humanitarian program, and macro level is the country level who are designing a program and policies. So that was my humanitarian context from a leadership point of view, and I wanted to understand how people are engaging in leadership. So from a cluster point of view, I have, as I mentioned, I have observed the cluster meeting to see how people are engaging in leadership, or what does leadership mean at the cluster level. I have changed the photo because just to protect the identity of individuals. And we have seen a lot in terms of human attributing power and agency to human in leadership space, but we haven't really seen how people are engaging, in different spaces. And that was quite interesting in this research, where there is a lot from non-human point of view. The cluster meeting arrangement was really interesting to see how communication, how issues are communicated in terms of raising questions and talking about key decision making. So I have observed the cluster meeting from time to time, and it was really interesting that the discussion, the communication, the relationship, there was quite unequal relationship in the cluster meeting. And that is like, I have divided the cluster meeting table in 3 points or in 3 different categories. The section A was quite predominant, powerful individuals was represented. And the section B was also powerful individuals. But there were people that were sitting at the back row or at the end of the section C. And people who were seated at the section A, which was quite interesting to see that most of the decision and issues were communicated at section C. And people who were seated at section B and C or at the back of the second row, they were not able to raise question or communicate issues. And it was interesting that there was an unequal relationship. But having said that, the cluster meeting had a kind of circular discussion. So issues were raised from time to time, and it was circulating in the meeting, but it was difficult for individual leaders to come up with decision and also to highlight how we can provide solution to the meso level, which I will talk about in the next slides, or at the micro level, where the affected people are affected by crisis. So this is actually about the micro level leadership. People who are working with affected people to provide direct assistance, they were coming on regular basis to file an application for assistance. And that was quite interesting how they, men and women, came together in a crowded environment where, from an Afghan culture point of view, it was perceived like an undignified relationship to put people in a crowded situation. But in other places where the joint need assessment was conducted at the micro level, the place had a strong influence on the discussion, on the communication. For example, the joint need assessment, which was conducted in mosque setting, there was a quite strong influence of religious protocols and the split of men and women in the mosque, but the separation of men and women by gender. And in a tribal hall or in community center, it was more of sensitive community issue, tribal relation, and how the aid can be distributed between different actors or tribal. So the place had a strong influence on discussion and practice and communication, not only at the micro level, but also at the cluster meeting in terms of who was positioned in the cluster meeting or where people were seated at the back row or in the front row. And they had, people who were seated quite at the section A, as I discussed before, they had more access to people or to talk about certain issues. So from a leadership literature point of view, there is a lot in terms of human-centered behavior, character, or key attribute from scale point of view that are always attributed to human leaders. But there is very limited understanding of humanitarian places, spaces where the joint need assessments are conducted, like in mosque or Jirga hall, or where the aid is being distributed. So it is the other factor, key factor, was also the sociomaterial. For example, the meeting table, the section A, B, and C of the meeting, where people from the back row were not able to raise question or effectively communicate their concern about issues. Time and temporality had another key shaping or directing component. For example, when we were traveling to the affected community, we reached to the community at 1:30, and that was the time for prayer. So we went, the joint need assessment was directed to the mosque to pray with the affected people. And then the women team or the group of women from the joint assessment were separated and they went to the community house to talk about, because culturally, women are not going to mosque to discuss about issues. So gender sanctioned places and spaces and its effect on the communication, practice, and the provision of assistance has a key component. So as I've talked earlier, so there are 3 different layers of humanitarian leadership. At the macro level, actors are taking the lead, like designer role or negotiator role, coach or collaborator, and they are designing humanitarian programs or policies, or regularly attending humanitarian meetings, cluster meetings, operation coordination meetings. So their leadership is largely, for example, in the humanitarian cluster meeting, it is a circular, regular circulating dialogues between the members to talk about certain issues. At the meso level, leadership become really mediating and interpreting or translating the micro level, the affected people level issues to the macro level, to the policy level, and connecting that with the issue between micro and macro level, connecting, and that is the job or for meso level. This is the final framework that I've come up throughout my leadership research in this study, that it is not only human who are playing key role in decision-making, practice, or day-to-day relationship. It is also the non-human, the place and space. For example, the mosque, the Jirga hall, the open space. Activity or practice that were conducted, for example, in open space were far more direct without incorporating religious protocols into humanitarian processes. But where activity was conducted in mosque, it was largely led by the religious protocols, and there was a strong influence of place. And sociomaterial is the other key factor that has a shaping or contributing factor, like the meeting table, where people were seated at the back row, they were not able to contribute to the discussion effectively, whereas people in the section A were able to make effective contribution. And of course, temporality in the sense of current, past, and future. For example, 1:30 was the time for prayers, and that has shaped our discussion to the mosque. And but also broadly, for example, activity that we're conducting during the month of Ramadan, the humanitarian team had a very strong enthusiasm to provide assistance to the affected people. So this framework has constructed, the everyday practice has constructed 3 different layers of leadership. Systematic leadership that is largely present in the headquarters or major organization, where actors are designing program and policies. Translocal or translational leadership is more interpreting policies and programs into operational aspect at the micro level. And organic leadership is more of working directly with affected people as intervener in mosque, Jirga hall, or open spaces to provide the assistance design at the macro level. So this means that humanitarian leadership is not only clear-cut ideas or skills or attributes that we have been always presenting. It is more of a complex picture that has the agency of affected people and those affected by crisis. So affected people, in my research, had a strong agency. They are not powerless. They have power in terms of having their voice to incorporate into the humanitarian policies and structure. Thank you very much.